How does gender and disease incidence affect an at-risk individual's use of preventive services, and how can disparity be decreased? Preventive services are usually defined as the routine healthcare that we usually go through to prevent the development of chronic diseases. It can vary from physical exams to immunizations and also cancer screenings. Here are some findings pulled from multiple studies. Although these statistics may be similar across them, they do not represent every individual case, as social influences seem to be a deciding factor. On average, the majority of men experience more chronic illnesses at an earlier age. They are also less likely to expressively recognize unhealthy behaviors and thus do not take advantage of many preventive services. Male behavior is said to purposely undermine health, making it so that risky behavioral tendencies are becoming a male trait. Women are seen to be more likely to make better decisions on their health and are less likely to engage in behavior that would undermine their own health. Women also constitute the large majority of individuals seeking psychological services. Here's an example of disparity on the use of medication treating depression.
We have additional evidence about the effectiveness of screening and treatment in pregnant women and peripartum women. There's much more information available in that population to make us confident that screening was effective.
While several treatments are available for pregnant and peripartum women, the task force recommends that clinicians and patients work together to determine the best approach to treatment.
Because there is some suggestion that some medications that are used for treating depression may have adverse effects on the fetus.
The task force also continues to recommend depression screening in older adults.
We still need more evidence in older adults about the effectiveness of screening and treating depression on outcomes. We really need to be a little bit more active in finding patients with depression and treating them effectively, and this recommendation reinforces that.
Catherine Dolph, The JAMA Report.
On studies focusing on minorities, it was found that while a combination of a lack of adequate health care, nutrition, and housing contribute to health problems for some African Americans, men still constitute for higher cancer death rates than women. When discussing alcohol and depression, men experienced higher health costs due to a predisposition to depression when dealing with their alcoholism, even while women shared the same symptoms and remained undiagnosed. In another study on college and depression, college males suffering from depression were less likely to seek help or self-disclose when compared to women. In contrast to the previous studies, there have been alternate views. One major view, such as the sex role theory of socialization, states that gender represents an exclusive role container and assumes that they have innate psychological needs for stereotypic traits. This would suggest that gender does not have much of a significant influence on the development of certain medical conditions, and that stereotypes are a driving force. One suggestion for reducing disparity across gender is to have health education focus on a more gender-neutral viewpoint. It should not imply any differences on the way an individual should behave regardless of gender. This can promote healthy behaviors and appeal to males while at the same time get rid of stereotypes.